Good morning, distinguished guests, esteemed partners, colleagues, and friends joining us today on site, right here at Chardonnay by Astoria, and those watching our Facebook live stream. On behalf of the Philippine Institute for Development Studies and UNICEF Philippines, a very warm welcome to the official publication of our book entitled Raising the Bar: Understanding and Solving Chronic Malnutrition in the Philippines. I am Louis Dagoy, and I will be your host for today. We are gathered here today to confront one of the most persistent challenges to our nation's future. This book represents years of dedicated research aiming to provide a holistic understanding and actionable policy recommendations to address chronic malnutrition. So, for that, thank you for joining us for attending this important event. With that, allow me to thank the presence of the organizations that are right here with us today for this book launch. We have representatives from the national government agencies such as the FNRI, DOH, ECCD Council, the DSWD, the DA, and the EDCOM2. We also have representatives from the academe. We have representatives from the USC Office of Population Studies Foundation Incorporated, the University of the Philippines Manila College of Public Health, a UPD College of Education, a UPD Department of Food Science and Nutrition, and also we have the PUP Department of Nutrition and Dietetics. From the local government units, we have representatives from the Pasig City Health Department, the Quezon City Health Department, as well as the Makati City Health Department. Joining us also here, of course, are partners from UNICEF, UNCHR, the World Bank, the Asian Development Bank, the Kalusugan ng Mag-ina Incorporated, Knowledge Channel Foundation Incorporated, the Philippine Business for Social Progress, the Philippine Stakeholders for Nutrition and Dietetics, the Nutrition Foundation of the Philippines, the Nutritionist Dietitians Association of the Philippines, and last but not the least, the Philippines Association of Nutrition. Thank you for joining us today. Now, we encourage everyone to join in on the conversation and be heard online. Just don't forget to use our hashtags, hashtag raising the bar, hashtag child nutrition PH, hashtag PIDS UNICEF book launch, hashtag policy research, hashtag nutrition matters, and lastly, hashtag for every child. To formally start the event, let us welcome the president of the Philippine Institute for Development Studies, Dr. Philip Arnold P. Tuaño, for his opening remarks.
Good morning, everyone, and welcome to the official launch of our joint publication of both the Philippine Institute for Development Studies and the United Nations Children's Fund, or UNICEF, of the book entitled Raising the Bar: Understanding and Solving Chronic Malnutrition in the Philippines. First of all, I'd like to recognize and express my deepest gratitude to our partners here present today. Thank you for continuing to champion policy research on child health and nutrition with us. From the UNICEF, we are honored to have with us Ms. Kyung-Sun Kim, the UNICEF representative. I understand this is your first month in the Philippines, so welcome. And Ms. Alice Coray, our the nutrition manager, our steadfast partners in this endeavor. We also thank the participation of our national government agencies, the Department of Health, Department of Agriculture, Department of Social Welfare and Development, Early Childhood Care and Development Council, and the Food and Nutrition Research Institute. From the local governments, we acknowledge city governments of Pasig, Makita, and Quezon City. Are all of you here, the local government units? Okay, so they're in the table. How about the national government agencies? Okay, so maybe they're still, well, I think I see some from the DOH and they're coming. To our colleagues from the academe and research institutions, nutrition professional organizations, international and private organizations, NGOs, and friends in the media, thank you for being with us. The publication, the book actually is very critical as it synthesizes evidence, insights, and recommendations that can help build cohesive and compelling narrative in addressing one of the country's most persistent development challenges, the persistence of chronic malnutrition. One of the central messages of this volume is this: while economic growth can raise incomes and expand food access, so as the country actually moves into the upper middle income status, it does not automatically translate to better nutritional outcomes. Improved public expenditure in health and nutrition helps, but we must deliberately direct resources towards nutrition-specific interventions, especially those that address intergenerational cycle of undernutrition, starting with maternal health and well-being. To reduce stunting and improve child nutrition, we need targeted, well-designed, and well-financed interventions that reach the most vulnerable. The book synthesizes the evidence and confirms that the most effective interventions focus on maternal nutrition and education, where more educated mothers are able to feed and care for their children, quality pre- and postnatal care, which ensures a healthy start for both mothers and infants, diets for child feeding programs, particularly for infants and young children aged 23 months and below, a critical window for development, as we know, in the first 1,000 days. From a policy and systems lens, the volume also emphasizes the need for public fiscal reforms such as nutrition tagging in national local budgets, a clear strategic integration of nutrition programs across agencies, and a stronger, better implemented Philippine Plan of Action for Nutrition. These steps ensure that nutrition is not siloed but becomes a core pillar of our development planning. The book also highlights that the context matters. Health, nutrition, water and sanitation, and hygiene or WASH initiatives must respond to the distinct challenges of each community, taking into account differences in resources, infrastructure, and cultural practices. Also, the promotion of integrated strategies for nutrition, including nutrition-sensitive agriculture, food for fortification, improved food environments in households, schools, and markets, and behavioral and social change communication, and promote better nutrition practices are very important. These holistic approaches are necessary if we are to ensure sustainable and community-owned solutions. Before I end, let me just thank those responsible for publishing, coming up with this volume. This publication should not have been possible with the tireless efforts of our co-workers at the PIDS and the UNICEF. And so let me recognize Dr. Val Ulep, who led the analysis and served as the overall editor of the volume. Okay, thank you, Doc Val, for leading this effort. Our contributing authors from PIDS and the UNICEF, Jan Oy, Lael Casas, Jana Talamayan, and Alice Rai. The consultants who authored chapters on stunting inequality, public expenditure review, WASH, social protection, food systems, and the evaluation of the Philippine Plan of Action on Nutrition. The PIDS Research Information Department led by Mel Quiñones for overseeing the publication of the book. We also extend our sincerest gratitude for our colleagues at the UNICEF Philippines. And we hope that this book serves as an invaluable resource for our key stakeholders, policymakers, and program managers working towards improving nutrition outcomes for children in the country. A call for deeper commitments, smarter investments, and strong collaboration to give every Filipino child the right to survive, grow, and thrive. Thank you, and we look forward to the conversations and engagement that these publications will be inspiring. Magandang umaga sa lahat.
Thank you very much, Dr. Tuanyo. Now, to provide us with a message of support from our partners from UNICEF Philippines, it is my honor to invite the country representative of UNICEF Philippines. Ladies and gentlemen, please welcome Ms. Kyung Sun Kim.
Good morning, colleagues and partners. Magandang umaga. I learned that word. Dr. Philippine Tuanyo, President, Philippine Institute of Development Studies, and our partners from PIDS, colleagues from government, development partners, and fellow advocates for child nutrition. As the Philippines is moving closer to upper middle income status, families today will say that have greater access to healthcare, education, and social protection than in previous decades. Yet, progress in child nutrition has not kept the same pace. Too many children still experience stunting, wasting, and other forms of malnutrition that hold them back from reaching their full potential. While stunting has declined over the years, progress is slow. In 2023, 1 in 4 children, 1 in 4, in the Philippines was stunted. About 2.2 million children affected before they reach the age of 5. Stunting or chronic malnutrition means children are too short for their age because they have not grown well over time. It reflects the conditions the children grow in, whether the families can reach healthcare, safe water, sanitation, and nutritious foods. Stunting develops gradually, especially when children miss out on proper nutrition and nurturing care during the critical first 1,000 days of life, from conception to a child's second birthday. This book, Raising the Bar, examines these conditions through evidence from communities and national data. This study points us to why chronic malnutrition persists and how better governance, stronger local systems, and sustained investments in child nutrition can make change possible. The government has taken important steps to improve child nutrition through the first 1,000-day law and investments in the Philippine Multi-Sector Nutrition Program, or PMNP, as widely known now. This program brings the law to life by turning national policy into action at the community level. UNICEF continues to support the government in delivering multi-sectoral nutrition interventions at scale. Through the PMNP, we are working with the Department of Health and the Department of Social Welfare and Development to promote better nutrition practices through evidence-based social and behavioral changes. This ensures that families receive consistent support and guidance in their communities. Together with the Department of Health, we are also helping local governments plan and budget for nutrition and monitor the impact of their investments so that what works can be sustained and scaled across the country. Earlier this year, the government enacted Republic Act 12199, or the Early Childhood Care and Development System Act. It aims to ensure that every child in the Philippines receives quality care, nutrition, and early learning from birth to age 5. But true progress means taking to scale proven impact, climate resilient, shock responsive interventions to prevent stunting and other forms of malnutrition in early years of life. This is why the findings of this book, Raising the Bar, are essential for shaping the country's next phase of action on maternal and child nutrition. This study reminds us that chronic malnutrition does not happen overnight, and that it is shaped not only by the conditions families live in, but the systems that are meant to support them. More importantly, it shows us that progress requires continued investment, stronger coordination, and leadership that keeps nutrition high on agenda, and especially during crisis. UNICEF remains committed to working with the Philippine government at both national and local levels, along with other partners, to ensure that progress in development also means progress in maternal and child nutrition. We will continue supporting efforts to build stronger systems and services that reach families where they are and give every child the chance to grow learn, and achieve their full potential. Thank you again and for joining us here today. And we look forward to working together harder and smarter for every child. Maraming salamat.
Thank you very much, Ms. Kim and Doc Duanyo, for those inspiring messages that reminds us why today's milestone is truly worth celebrating. At this point, we come to the highlight of today's program, the ceremonial launch of the PIDS UNICEF book, Raising the Bar, Understanding and Solving Chronic Malnutrition in the Philippines. To officially mark this milestone, may I call on again on stage Ms. Kim and Dr. Tuanyo for a quick photo opportunity, symbolizing our shared commitment to advancing evidence-based policies. May we also call on our authors from both PIDS and UNICEF who are with us today. Kindly proceed on stage as I call your name. Mr. Lyle Darrell Casas, Ms. Jana Uy, Dr. Valerie Gilbert Ulep, Ms. Jan Tricia Talamayan, Mr. Alfredo Jose Ballesteros, Ms. Julian Lechuga, Mr. Christian Nuevo, Ms. Alisa Cyril Villanueva, Dr. Mario Capanzana, Dr. Maria Asuncion Silvestre, Ms. Rosella Agoali to be represented by Ms. Maya Faisal, Ms. Maria Evelyn Carpio, Ms. Alice N. Coroy, Ms. Carlinette San Valentin, Mr. John Michael Villaseñor, and Mr. CJ Peradilla. Please proceed on stage for the photo opportunity, please. Again, Dr. Tuanyo and Ms. Kim, please proceed on stage for a quick photo opportunity. Ladies and gentlemen, this photo opportunity officially marks the launch of the PIDS and UNICEF book. May we invite everyone to give our partners a big round of applause. Now, now we will be taking a group photo. To our PIDS and UNICEF colleagues, please position yourselves in front of the stage. We also request all our participants, again calling all our participants to compress in the center of the function room for a quick group photo opportunity, please. Again, calling the attention of all our participants, kindly proceed to the center of the room, please. Again, calling all the attention of all our participants, kindly proceed to the center of the function room. Thank you very much, everyone. Please settle down and return to your seats. All right. On your screen, you will see the photos of the authors behind this important publication. You can also scan the QR code displayed to access the digital copy of the book, which is available on the PIDS website. Printed copies of the book will also be distributed at the registration booth upon your exit from the venue. Once again, congratulations to everyone involved in this remarkable publication. Now that we've officially unveiled the publication, let's take a closer look at its key insights and findings. To give us a comprehensive overview of the book, may we call upon the book's editor. He is a senior research fellow at PIDS and the program director of the Health Economics and Finance program. He has authored discussion papers, book chapters, journal manuscripts on health financing, health policy, and nutrition. He provided technical assistance to governments and international organizations, such as the Center for Global Development, USAID, the United Nations, the World Bank, the World Health Organization, and the Asian Development Bank. Before joining PIDS, he worked at the World Bank in DC and Delhi offices, supporting countries in the South Asia region to roll out UHC reforms. He was a doctoral fellow at the Center for Global Health Research at the University of Toronto, a visiting fellow at the Nikkei Japan Center for Economic Research in Tokyo, and a fellow at the Hopkins School of Advanced International Studies. He holds a PhD in health economics. Now, his presentation will revolve around the first chapter of the book with the title, The Future of the Children in the Philippines, which tackles the challenges of chronic malnutrition in the country. Everyone, let us give a warm welcome to Dr. Valerie Gilbert Ulet.
I'll just have my note. Okay. So good morning, everyone. So thank you for being here. So medyo traffic, but again, thank you for gracing our event. No, so I'm very grateful for my colleagues at PIDS for mounting this event. To our president, Dr. Randy Tuanyo, and to our partners at UNICEF, led by the country representative Kyung Sun Kim. So good morning. So okay. So in 2018, so I'll just provide a brief history of this book. No, so in 2018, new at PIDS, no, and still under the leadership of our president, Dr. Celia Reyes, asked me to lead a nutrition study with UNICEF. And I need to admit that I was a bit hesitant because coming back to PIDS after a few years, I thought my research focus in health should be elsewhere, maybe health financing or health systems in general. Because in a country transitioning to an upper middle income country, I felt that in this day and age, chronic malnutrition should never be a problem. And the Philippines is not poor, right? But I didn't have a choice but to do the work, to do the research project. But as our health team dug into the data, one truth became impossible to ignore: that malnutrition in the Philippines is widespread. And it's heartbreaking and it's gut-wrenching. And that the Philippines is an epicenter of chronic malnutrition. As Dr. Randy mentioned a while ago, that even though we are an upper middle income country, our stunting rates are actually comparable with notoriously high stunting rates in Africa or in South Asia. So in our earlier works in 2018 or 2019, we called the malnutrition, chronic malnutrition, as a curse. And to me, it's indeed a curse because it steals our children's future, shrinking their growth, learning, and economic potential. And about 1 out of 4 children in the Philippines are affected by it. So if this is the case, what future are we building for our children? So this book is actually an evidence and a call to action. So we break the curse by making children a national priority and by acting with urgency, coordination, and accountability. So this book is a culmination of years of work by PIDS and UNICEF. At PIDS, in the last, I would say, 5 years, we've produced more than 15 discussion papers and policy notes on nutrition alone, many in partnership with UNICEF, ranging from policy analysis to econometric analysis and novel methods for us to understand how much are we spending for nutrition. And a lot of these were also published in a peer-reviewed journals. So our findings have been presented in both houses, the Senate and the Congress, informed legislative deliberations and contributed to concrete reforms, not only in early education, but health and nutrition. So I want to acknowledge our co-authors and partners from UNICEF, especially Alice for her patience, from PIDS Lal Casas for all the heavy lifting in this book, colleagues across the Institute for all the hard work, and special thanks to Dr. Mian Silvestre, colleague, friend, and mentor, and to Ian Nuevo, to Alyssa, who are co-authors of this book. I'm also very grateful to former PIDS President Babes Orbeta for pushing us to write a book about nutrition, and to our, again, partners at UNICEF for their steadfast support. So you might wonder why we came up with a title, Raising the Bar. So raising a bar is a term because we want to stop setting for slow, sporadic, and uneven gains. Raising the bar means setting higher targets, enforcing tougher accountability, and investing in what works, not investing in politically convenient interventions. That's why it's raising the bar. And that means we need to invest in good nutrition in pregnancy, better and diverse diets in early childhood, safe water and sanitation, strong primary care, and effective social protection. And we have evidence to support that these interventions are the key, I would say, intervention that matters. Okay, so I'll just discuss the chapter 1. So basically, chapter 1 of the book asked a very simple question. What future are we building for Filipino children? So as we mentioned a while ago, that the Philippines is in the cusp of an upper middle income country. $26 na lang tayo, we will become an upper middle income country. However, many children in the Philippines, or as I would say, many of our outcomes are still comparable to the poorest countries in the world. So in this chapter, to have a different, I would say, take on why are we having this problem, we try to dissect health outcomes in the context of a macro fiscal lens. If the economy is growing, why aren't our children nutrition or health outcomes keeping up? So this first chapter, shows how welfare has been left behind despite success in economic growth, and what must change to turn fiscal space into real gains for children. Okay, so in the first chapter, we discussed a lot about health outcomes. We dissected a lot the current state of health outcomes, especially for children in the Philippines. So the first question is, are Filipino children healthy? So a first lens to understanding the health and nutrition of our children is looking our infant mortality rates. Today, the Philippines stands at 21 deaths per 1,000 live births. That's actually better than the past decade. In other words, 97% of babies in the Philippines now reach their first birthday. But if you compare this to other countries, especially among upper middle income country, this is still very low, right? So infant mortality reflects the strength of our neonatal care, immunization, and overall quality of services. And it made worse by malnutrition, where wasted and stunted children are 12 times more likely to die. So the progress is real. The improvement in infant mortality rates in the Philippines is actually real, but not enough. So in the Philippines, infant mortality has fallen much more slowly than in our neighbors. No, you can see the red line. It's just it's not as fast as we want. So you can see Thailand, Malaysia, Vietnam, and even Cambodia dropping at a very fast rate. No? Because of this low decline in infant mortality, the Philippines missed, for example, the 2015 MDG targets. And in the paper, we've argued that without major reforms, we are risking, or we will miss the 2030 SDG as well, if we are just business as usual. And the message is clear that progress is real, but not enough, not at a pace our children deserve. Okay, so here's the uncomfortable truth. So the Philippines is, as I mentioned a while ago, on the verge of an upper middle income country. $26 na lang, then we'll become an upper middle income country. But many child health and nutrition outcomes still resemble those of the poorer countries in Africa and in South Asia. So on the left, you will see here that our stunting rate line inches down, while neighbors like Vietnam and Peru, or even China, for example, these are high-performing countries, you will see large decline in chronic malnutrition. On the right, basically, is the scatter plot showing that the GDP growth rate did not translate into faster nutrition gains for the country. So in the paper, we are arguing that growth alone won't fix the problem of child and nutrition health and nutrition challenges in the Philippines. So we have to raise the bar. So if you look at traditional economic books, economic growth is assumed to fix nutrition. That's the usual understanding of how economic growth affect nutrition, meaning higher incomes that will lead to better diets, then obviously it will result into less stunting. But the data says it may not be true. The Philippines has sustained GDP growth rate, yet stunting has fallen only slowly. So on the right, we've already shown this a while ago, that the country growth rate versus change in stunting. And what you can see here, that many countries reduced stunting faster than we did, with similar or even lower growth. So we begin to ask, why stunting is stubbornly high in the country despite the relatively high growth? So from macro fiscal perspective, it means that higher growth expand fiscal space, meaning that when your GDP growth, when your economy increases, you will raise revenues, and you will have affordable borrowing for health and nutrition, right? But growth improves nutrition only if resources are allocated and executed well towards cost-effective, evidence-based intervention, and these resources are distributed equitably. So in the first chapter, we try to answer, why hasn't growth fixed malnutrition. And we argued for several reasons. Number one, higher revenues because of higher GDP don't automatically raise health and nutrition spending. In one of our studies, we look at LGU spending. And what we've seen is that LGU data is quite, or I would say LGU spending is quite inelastic, meaning a 1% rise in revenue lifts per capita health spending by only about 0.27% overall. And the source of the resources doesn't matter, may it be national, transfer, or grants, meaning that we argue even if you increase your national transfers to local government, we will not be sure if that will translate to higher spending in nutrition or health. Second, and I think this was also discussed, I think in second or third chapter, is that we under-prioritize cost-effective programs. Majority of our resources are into school feedings, for example. So we are under-prioritizing cost-effective programs in the first 1,000 days, but not necessarily interventions that could reduce stunting. Third, growth is unequal. Gains concentrate among higher income groups, so poor households see little improvement in diets, care, and living condition. And lastly, the challenges of social determinants, such as overcrowding, poor wash, and unsafe environments continue to heighten stunting. So the takeaway of the first chapter is that growth creates fiscal space, and we've seen that over the last decade. But without prioritization towards cost-effective intervention, nutrition or chronic malnutrition will slowly, we will see a slow decline in chronic malnutrition rates. So if growth alone does not fix nutrition, the next question is, who is being left behind? And this was also discussed in the first chapter. The data points to deep inequalities in terms of chronic malnutrition and the issues on intergenerational cycle that starts very early. So here on the left, you can see stunting rises sharply for the poorest 40%, starting even at around 6 months and peaks at the first 1,000 days. So if you do not fix the first 1,000 days and we are only fixing it during first grade or second grade, we are missing a lot, right? So on the right, so we also try to understand the disparities in terms of chronic malnutrition. So on the right, the Philippines sits among those with the largest stunting gaps between the poorest and the richest, yung naka-red, no? So if you look at the absolute difference between the poorest and the richest, we have the highest difference. And you don't see this disparity in terms of chronic malnutrition in our neighboring countries, right? Okay, so and I think this will be my last slide. So those inequalities don't fade with age, no? So we see the disparity starting at 6 months, but those inequalities don't fade with age. They compound and pass from one generation to the next. So we try to understand the weight of women in the Philippines. So on the left, you see the average weight of 5-year-old girls over time. For example, countries like Thailand, Vietnam, Indonesia have pulled ahead, while the Philippines lags near the bottom. So you can see the height of 5-year-old children in the Philippines are just the same for the same age cohort, right? So on the right, Filipino women of reproductive age, if you look at their height rises steadily with income, right? From 150 centimeter in the poorest group to 153 centimeters in the richest. So there is really disparity, and that persists during their adulthood. No? So why this is important in the discussion of intergenerational cycle of chronic malnutrition? Because shorter adult women are more likely to have low birth weight, stunted babies, and keeping the cycle alive. So breaking stunting means acting early and lifting the conditions of the poorest household so we can break the curse. So I think that's the end of my presentation. But again, this is just a snippet of the first chapter. So maraming salamat. So thank you.
Thank you very much for that enlightening discussion, Dr. Ulep. Now, building on that presentation, our next presenter will delve into the strategic approaches in addressing maternal and child health issues. He is a senior research specialist at the Philippine Institute for Development Studies and also a member of the Health Economics and Finance program. His published work includes peer-reviewed research articles and discussion papers on health systems policy and nutrition. Under Dr. Ulep's direction, he manages the nutrition research projects at PIDS, including those in partnership with UNICEF. Prior to joining PIDS, he worked at the Food and Nutrition Research Institute for the conduct of the 2018 to 2020 Expanded National Nutrition Survey. He is a registered nutritionist dietitian with a master's in public health, focusing on epidemiology and biostatistics at the University of the Philippines, Manila. Let us all give a warm round of applause for Mr. Lyle Daryl Casas.
Pleasant morning to everyone present here today. So it is my pleasure to share with you the key insights from the PIDS UNICEF book, Raising the Bar, Understanding and Solving Chronic Malnutrition in the Philippines. So as I mentioned a while ago, this book is a compilation of years of research by the PIDS in partnership and with support, of course, from the United Nations Children's Fund Philippines for the Philippine government, and brings together the research of around 20 chapter authors across 8 chapters, woven into a coherent narrative under the lead editorship of Dr. Val Ulep. Okay, so to start, we anchor in this presentation our synthesis on the UNICEF's conceptual framework on malnutrition. So this framework helps us understand what determines malnutrition and how different systems interact, influencing maternal and child nutrition. So the immediate determinants, including the child's diet and care, explain whether children are eating enough and receiving appropriate care and feeding. Next, the underlying determinants, including our food, practices, and services available to children and women in their households, communities, and environments, enabling the good nutrition in the form of the good diets and care. And then lastly, we have our enabling determinants, which are the political, financial, social, cultural, and environmental conditions that enable good nutrition for children and women. So this is organized into resources, governance, and norms. We use this framework to map key insights from each chapter of the book and trace how the different determinants connect to nutrition outcomes. We begin with our outcomes, which is the chronic malnutrition and child food poverty. So a child's height or stunting status, according to many empirical studies, is a strong determinant of human capital and a predictor of economic productivity. In the Philippines, the prevalence of under 5 stunting has generally been declining over the years. So in 2023, the recent results of the National Nutrition Survey noted that 24% or around 2.2 to 2.6 million children under 5 were stunted. But looking back over 3 decades ago, this was almost double. However, the Philippines had to settle with around 0 to 1% average annual decline, which is still above the average stunting prevalence for upper middle income countries, which we are slowly transitioning into. Still, while it declined, stark inequalities still persist, and this slow progress is reinforced by the large inequity across socioeconomic classes. So, as mentioned also earlier, in 2023, around 4 in 10 poorest households suffered from stunting, while only 1 in 10 of their richest counterparts were stunted. One important root of these inequalities lies in what children eat. So many Filipino children, especially those from poor households, fail to meet the minimum standards for diet diversity and frequency. So we've noted in our analysis that 62% of Filipino children do not meet the minimum dietary diversity. And in terms of minimum acceptable diet, only 35% among children from poor households meet this. This food poverty in children fuels also the persistence of malnutrition and contributes to the inequalities. Given our problem on chronic malnutrition and child food poverty, we deep dive into each factor that could be attributed to this. And then first, on the immediate determinants or good diets and care. Good diets and good care go hand in hand. So unequal access to this leads also to unequal child health as well. So our analysis from the chapter 4 of the book shows that there is a socioeconomic gradient on the burden of diarrhea, which is usually an indicator of poor health or infection. So in 2021, we've seen that children from poor households were 3 times more likely to be experiencing diarrhea compared to their affluent counterparts. So we all know that exposure of children to infection suggests that there is an increased susceptibility to illness and reinforces the need for them to access primary care services. However, the NDHS 2022 reports that among the children with diarrhea from the poorest households, only 32% was able to seek treatment. And further, around 20% of individuals who experiences diarrhea did not receive zinc and ORS, and we know that persistent of infection affect the body's ability to absorb nutrients, hindering their growth and development. So given that, we ask the question, what could be the cause of these issues or inequalities? And to answer that, we go back again to our framework and discuss the state of affairs in the following components of this framework, and we deep dive now on the underlying determinants. So these underlying determinants, which are the foods, practices, and services, shape diets and care, influencing our outcomes. And we will discuss this through the water, sanitation, and hygiene, food systems behavior, social protection, and food systems environment. Okay. We start with water, sanitation, and hygiene. So to achieve quality care and services, the diets of children, including drinking water, should be, of course, safe. And furthermore, the sanitation services in the environment should remain optimal to prevent diseases. In the Philippines, wash coverage appears high overall. However, the last mile areas tell a different story. The persistent open defecation and unsafe water in last mile areas drive infection and diarrhea in children, perpetuating the infection malnutrition cycle among the poorest children. Our analysis in the chapter 4 of the book revealed that in Quezon, Masbate, Samar, Negros, Lanao, Basilan, Sulu, Mindoro, and Palawan, approximately 4 in 10 children under 5 are practicing open defecation, and these areas are usually far-flung and are not consistently reached by our usual health and nutrition services. Overall percentage of the population accessing surface water or unsafe water remains low at around less than 1%. However, when we look at the last mile areas, including Barm and Mimoropa, this rises to 10 to 50%. Next, in terms of services, social protection particularly, these social protection services, we are expecting that these can improve child's diet and care, by helping improve the household's access to food, health, and care resources. And this is exactly the objective of the country's flagship poverty alleviation program, the Pantawid ng Pamilyang Pilipino program, or 4Ps, or our conditional cash transfer, aim to improve the human capital of children in low-income households by investing in their health and nutrition, as well as their education. So findings from our analysis, as you can see in the chapter 6 of the book, revealed that while 4Ps contributes to poverty reduction and health-seeking behaviors, evidence supporting this positive impact of 4Ps on children's nutritional state is inconclusive, similar to global experiences in conditional cash transfer programs. This lack of conclusiveness this lack of conclusive evidence may be attributed to several reasons, such as program design, implementation, monitoring, contextual factors, and other unwanted effects. Next, we discuss another component of the underlying determinant that shape children's diet and care, which is the food systems. A component of this are food environments, which refer to the individual and household level factors that consumers bring to the food environment, such as purchasing power, access, convenience, desirability, and these inform why people choose to procure the foods that they do. In the Philippines, we have issues on accessibility, including affordability and availability, and this is discussed in the chapter 5 of the book. In the Philippines, we've noted that there is a high food expenditure shares among the poor, which limit their access to nutritious diets, highlighting the deep inequities or inequalities in food affordability. Filipinos, on average, spend about 43% of their expenditures on food, and the poor allocate the highest share, which is about 65% of their expenditure on food, higher than the allocation on food of the middle income, or more than doubling that of the rich households. So with the significant income of our households going to food, families may already struggle to secure adequate nutrition for their children, potentially limiting their ability to budget for other necessities such as healthcare and education. Food affordability also drives inequalities in consumption across income groups. As wealth increases, so does the consumption of protein-rich sources and fats and oils. Meanwhile, poorer households depend on cereals and cereal products for majority of their daily consumption. And many children in the Philippines suffer from malnutrition due to this inadequate consumption of protein-rich foods, which are vital for addressing this issue, but are often unaffordable for most families. This disparity may be attributed to the escalating food costs relative to income levels. And furthermore, in the chapter 5 of the book, we discussed also the widespread consumption of ultra-processed foods, which is increasingly normalized in the Philippines, driven by affordability, availability, and as well as the aggressive marketing tactics by the food industry. In terms of the behaviors and practices surrounding maternal and infant young child feeding, we've noted the gaps in the correct knowledge and practices that these deepen also the inequalities in child nutrition. The national data shows that more than 3/4 of the mothers consume unhealthy foods and beverages. And furthermore, there are substantial gaps in breastfeeding knowledge and practices. We've noted that awareness of exclusive breastfeeding duration is lowest among the poor mothers, around 40%, compared to 30% among the richest. And then, in addition, recent data alarmingly show that there is a decline in appropriate IYCF practices that was observed in recent years, despite the Philippines being among the best practice countries for IYCF and the gains that we have been able to achieve recently. So a deep dive on IYCF practices shows that nearly half of the children aged 6 to 23 months consume unhealthy foods, and around 1 in 3 children do not usually consume fruits and vegetables, reflecting deeper systemic and food environment issues. So we've discussed the outcomes, the immediate determinants, and the underlying determinants discussed in the book. Now we move on to discussing the enabling determinants such as nutrition, financing, and governance. In terms of nutrition financing, at both the national and local level, nutrition financing remains fragmented and incoherent. So these insights are discussed in chapters 3 and 7 of the book. At the national level and at the local level, at the national level, nutrition-related spending in 2017 to 2019 reached 492.7 billion or 1,554 pesos per capita, equivalent to less than 1% of GDP and 7.9% of total government expenditure. At the local level, our analysis revealed that financing remains skewed, fragmented, and unpredictable due to the absence of the mandated budget for nutrition and local governments. And further budget allocation and expenditures are often shaped by local politics and the mayor or the local chief executive's priorities, leading to variability or inequalities in the implementation of nutrition programs across the local government units. And at both levels, the national and the local level, we've seen that spending is mostly for the nutrition-sensitive program with limited support for nutrition-specific and very little to enabling interventions. And we've also noted, as discussed earlier, that the allocations usually misalign with the first 1,000 days continuum. Okay. And in terms of governance, we have the Philippine Plan of Action for Nutrition, or the PIPAN, which guides the country in addressing maternal and child nutrition. In Chapter 7 of the book, the evaluation of the PIPAN 2017 to 2022's implementation was discussed. So our analysis revealed disjointed national governance and inequalities in local implementation hinder or undermine the delivery of nutrition programs. So while the regional and city municipal governments recognize and integrate the VPAN in their plans, in their investments, implementation remains unequal and variable at the barangay level or the level of government who are expected to deliver some of the nutrition services. Moreover, program priorities and implementation often depend on the local chief executives and are limited by the availability of the human resources at the local level. So we know that good governance at all levels, particularly under the guidance of the national government through the National Nutrition Council, is crucial in ensuring the seamless integration of all the key actors and implementers of nutrition intervention. So we were able to discuss each factor noted in this framework and each key insight from each chapter of the book, exploring how various enabling, underlying, immediate determinants discussed there influence maternal and child nutrition, specifically chronic malnutrition. Summarizing this, we emphasize that chronic malnutrition is the sum of unequal systems. The evidence presented in the book is clear. Chronic malnutrition is not a single sector failure. It is a cumulative result of weak linkages across food, health, WASH, social protection, governance, and financing system that should together ensure good diets and care. Raising the bar demands breaking silos, addressing inequalities, and advancing comprehensive, continuous, and convergent strategies that weave efforts across all sectors and levels. So this requires leadership that bridges together various sectors and levels of government and even our non-government partners. Raising the bar means more than reducing stunting. It means ensuring that every child in the Philippines, regardless of where they are born, can grow healthy, nourished, and with an equal chance to thrive. So that is all po for my presentation, and thank you very much.
Thank you very much, Mr. Casas, for that wonderful presentation. Now that we're equipped with the knowledge and findings on the book that discusses the inequalities and the gaps addressed in chronic malnutrition in the Philippines, I'm sure that this book can serve as a major vital role in data-driven policies and in producing actionable policy recommendations. So again, thank you, Dr. Ulep and Mr. Casas, for that wonderful presentation. So now we proceed with the panel discussion. I hope you're able to enjoy your snacks before we proceed with the segment. And now I call on Ms. Melinda Quinones, the Department Manager 3 of the Research Information Department at the PIDS, to moderate the panel discussion segment of this program.
Thank you, Louis. Good morning, everyone. Are we okay? Good morning to our online participants joining us today live at the Chardonnay by Astoria in Pasig City. Okay, so thank you to our presenters for setting the stage with such compelling evidence and insight. So we will dig more about this topic as we call on our discussants. So we've just heard that this is not just a nutrition story. It's governance, it's equity, and human development story. So the book Raising the Bar, which later on, as I was told, you will be receiving a copy, it gives us a clear message. If we want to secure the future of Filipino children, we must act earlier. Or are we late? Or we must act smarter and we must act together. We cannot do it. PIDS cannot do it on our own. UNICEF Philippines cannot do it on their own, right? So we should work together on this one. So now we move on to the panel discussion and open forum. So this is a space where we will unpack what these findings mean in practice, especially for our policymakers and decision makers at the local and national levels, those who are implementing national nutritional policies and programs. So joining me on stage are three key champions in this effort. So may I call on our first discussant, Ms. Alice Encoroy. All right, I will introduce Ms. Alice. She joined UNICEF Philippines as nutrition manager in October 2019 with over 20 years experience in nutrition program design, implementation, management, and technical advisory across Africa and Asia. Alice brings a wealth of expertise in her role. And before her current position, she served as country manager for Ghana and Malawi under the USAID Fund and Nutrition Technical Assistance Project, or FANTA. Alice holds a master's degree in medical science, human nutrition from the University of Glasgow, and a bachelor's degree in food nutrition and dietetics from Kenyatta University in Kenya. Welcome. Welcome, Alice. And may we have a round of applause, please? Thank you. For our second discussant, we have Dr. Maria Asuncion Silvestre, or shall I call you Dr. Mian? All right. Dr. Mian is the founder of the Kalusugan ng Mag-ina Incorporated and standing committee member of the EDCOM2 Early Childhood Care and Development, or ECCD. Dr. Silvestre, or Mian, is an award-winning Filipino physician recognized for her pioneering advocacy in breastfeeding and for developing Unang Yakap program, an essential newborn care protocol widely used in the Philippines and numerous other countries. Her influential career spans clinical practice, academia, nonprofit leadership, and policy advisory roles. Ladies and gentlemen, please welcome again Dr. Mian. Okay. So finally, let us all welcome our third discussant, Ms. Janeline S. Iganya. Ms. Janeline? All right. Ms. Janeline has more than 10 years of professional experience in the field of public health and nutrition, focusing on maternal, infant, young child nutrition, health system strengthening, operations research, health promotion, and communication. She currently works as a supervising health program officer at the Department of Health, handling the maternal and early childhood nutrition programs. Welcome, ma'am, and thank you for being with us today. So we also call the two authors and the book editor, Mr. Lyle and Dr. Val Willem, on stage, please. Please join us in the open forum and panel discussion. Oo. All right. Now, everyone is seated. Do you have a microphone over there? All right, good, good. So everyone is seated now, and we'll hear from our discussant their views or thoughts about the book Raising the Bar. Let's begin with Miss Alice.
No, thank you very much, and congratulations to PIDS for launching this book in partnership with UNICEF. So I think Raising the Bar is a key book which highlights some of the evidence that we have, and a lot of which we already know anyway, but it also highlights some of the key systems gaps that many of us have been talking about over the years, and how we can actually really link in together with the first 1,000 days law. So I'll just want to highlight some of the key things that stuck in me. One is the issue of persistent inequity around stunting. So we see there's inequity from a geographic perspective, but at the same time, we are seeing that the poorest households continue to suffer most from the effects of stunting. Now, the second thing I would like to highlight is childhood poverty. As we can see, many children, I think it's really important to highlight that actually about 1 in 10 children consume what would call a nutritious diet, which is really, really low. And we are also seeing the high rise in unhealthy diets. So children will basically eat rice with a snack, which is high in salt or sugar. So obviously this is really moving towards malnutrition, leading them to all forms of malnutrition, not only stunting, but overweight and obesity in later years. I think it was important to see also nutritious food is expensive. It's difficult to access for the poorer households. So that's a point from my side. And we also saw clearly in terms of the weak governance and financing, we know there's a lot of progress that has been made so far at the local level, but then also we see there's some local government units or national agencies still need some form of technical support. I think just to also highlight the issue of financing, as we know that nutrition specific, as we call them, the high impact interventions, really for us to move the bar, that's what we need to invest more in. But we continue seeing a high investment in what would be nutrition sensitive interventions and may not have that much impact in the early years. So I think it's also to highlight the point that we need to really re-optimize, rethink about how we are investing in nutrition, look at where we should probably be moving more resources towards so that we can get the impact we are seeing. I mean, looking at the graph that Val presented, if as we get that $26 that we are short of, is there an investment that we can make to make sure that we shift towards more nutritious, more healthy, more healthy children in the Philippines? So those are the key things that struck to my area. And some of the key recommendations I would just want to highlight from our side is looking at how can we make financing. Number one, it's around financing smarter and more accountable. And just to highlight the importance of nutrition resource tracking. You know, unless we are tracking the resources, we will not know where they're going. And then unless we are also tracking the resources and linking it to results. So there's tracking the resources, the investment, but then we are linking it to the resources. And this can be helpful if we have scorecards at national level. If we have a local government unit, then we can have a conversation around where should be investing more in. So I think for me, that would be a key thing to help us in moving forward. Second is around creating healthy food environments for children. For example, enforcing unhealthy food marketing, junk foods, putting in place the laws and making sure that they're enforced. They can play a critical role in terms of addressing malnutrition, but also generating revenue for the country. So that's something that would be important. Very critical is around strengthening local governance, having in mind that, as we've seen very clearly, multi-sectoral nutrition is the way to go. We have to work together, bring all the sectors, health, food systems, agriculture, wash, social protection, bring them together, but then also work, coordinate, and collaborate at all levels. So at LGU levels, and at the same time having the data-driven planning to track how the investment, supporting the agency to deliver the interventions, but then also tracking their own investment. So thank you. For me, I'll just close by saying that really, this is really valuable investment, valuable evidence that we've just had as government is planning to scale up. I know there's now already discussions in terms of scaling up the PMNP. How can we use this evidence to inform the scale up of evidence-based interventions? Thank you.
Thank you so much, Alice, for those meaningful reflections. Now we have to rethink our investments in terms of financing. We have to invest more on resource tracking. It's very important, and also linking it to results. Later on, I will ask Dr. Val and Lyle to comment on your recommendations. Thank you for those. Let us now listen to Dr. Mian. Your insights, please.
Thank you. Magandang umaga po. I'm here as civil society, so I might make some bold statements.
It's okay.
Pero Val and Lyle, and of course the other chapter co-authors are sanay na sa akin. Thank you, Alice, and I echo many of what you've said. Val, thank you for the questions. So many questions, so many nagging questions that beleaguer us, no, and we're richer, but in the same time we're poorer because we haven't addressed the needs of our children. Thank you, Lyle, for the encapsulation of many of those chapters. Why am I saying that I might make bold statements? Is I'm going to go to that UNICEF conceptual framework with the foundation being governance. And I would have wished that it said nutrition governance, that it really pinpoints, I think, is heavily burdening us now. I just came from a climate resilience workshop, roundtable discussion a few weeks ago, and we were broken up into small groups to discuss the problem of nutrition security and climate resilience. And resonating from all the four groups was the fact of policy incoherence between national and local, and in between national agencies. We target stunting reduction, but in our schools, in our school feeding programs, for which we're spending billions of pesos, our metric is wasting and severe wasting. It seems that the terms, the very precise terms in nutrition are being used interchangeably, and we're using as a metric the data measured by teachers who have not actually been trained to measure the metric precisely, take the anthropometric measurements. And we're basing our health financing or our nutrition financing on a metric that can't seem to give us direction. When we talk about governance, we talk about institutions, we talk about their policies, and there's so much incoherence between the policies, and therefore the processes are a little confused. The messaging to families are confused. Even the rich don't feed their children appropriately, I suppose, because our obesity and overweight rates are also increasing. We demand that EO 51, our milk code, be implemented and adhered to, and yet other national agencies partner with leading formula companies. We talk about addressing stunting, but our timing is wrong. We target children that are already in the schools, where stunting is largely irreversible already. We only recently enacted the ECCD School Systems Act, and we're planning to expand programs, the results of which are not fully grounded in actual data on implementation and the association of the interventions with outcomes. I tried to make a PowerPoint, but but I couldn't. So I don't know if my 8 minutes is up, but the lack of emphasis on family support for breastfeeding. Wasting is at its highest prevalence in 0 to 5-month-olds. Are they drinking water at this time? They shouldn't be, because they're exclusively breastfed and therefore don't have to be fed water. But we rely on advocates and volunteers to help our families rather than support them in their work to help families. So we need breastfeeding counseling to optimize breastfeeding practices so that we can address the health inequities because of lack of appropriate IYCF practices. So I could go on, but I'd rather not. Maraming salamat po.
Thank you, Dr. Mian. I like what you said, no, that it appears to me that the persistent problem of our times really boils down to governance and the policy that is incoherent most of the time. That's why PIDS is here to check on those policies and prepare policy recommendations. I also took note that stunting is irreversible at the school level. So it should start at home at 0 to 5 years old, 5 months. Yes, that's why we have to educate the mothers. Okay, we have a lot to do. So thank you, Dr. Mian. Now let's hear from Ms. Jen. Insights, please.
Good morning, everyone. So thank you and congratulations again to PIDS, Val, Lyle, and thank you for inviting the Department of Health in this book launch. So I would like to note that yes, this may be the culmination of the activities for PIDS, but definitely not the interaction with the Department of Health, especially moving forward with the findings that you have in this book. So one of the things that I would like to highlight is from the Department of Health's perspective and even up to the local government units, I think one of the things that has to be highlighted is that there is no dichotomy between health and nutrition. So they share the same determinants, and addressing nutrition is basically addressing the overall perennial problem in health. So we already saw the evidence how the interventions, the nutrition-specific and sensitive interventions directed in the first 1,000 days have long-term impact, especially in our NCDs and even in our economy. So, so in terms of the call to action on raising the bar, the first question is, where are we measuring ourselves against to first? So Lyle mentioned about the PPAN as the national blueprint, which outlines the activities and the endeavors of all the sectors. And in the Department of Health, the health sector, we also did establish the standards across all levels of care when it comes to addressing not just malnutrition, but all the health inequities that needs to be addressed to be able to ensure that we actually contribute to the reduction of stunting. However, these major reforms at the national level are often not translated at the local level. So it's the adoption of our local government units that you have also mentioned as part of your findings. So it's it's apparent that there are local government units that are able to do so. So we are currently in Pasig, and one of the local chief executives that is being looked up to in terms of governance is Mayor Vico Soto. So if it can be done in Pasig, I know that there are several LGUs on the ground that are also able to demonstrate. It's just that we are not able to harness that. We are also observing that over the past years, over the past decades, we have a lot of projects, small scale interventions that fail to scale up and are not actually sustained, because most of the time these interventions are donor driven. The resources are usually external, so we fail to sustain these initiatives, and the LGUs are left on their own to go back to how they used to implement their regular health and nutrition interventions. So in terms of inequalities and disparity, in 2018, with the passage of two of our hallmark legislations, the UHC Act and the First 1,000 Days Act, we were hoping to see a lot of the changes, especially now, because nutrition interventions require a long time to see the impact and how the interventions are going. And given the most recent National Nutrition Survey, we see that we are improving in a way. We are able to reduce stunting, but yeah, we agree that it is not in the way or in the rates that we are expecting it to be. But we are there. We're moving towards that goal. To be able to intensify, we also acknowledge that from the health sector, we are caught in the middle of transitioning. So with the UHC Act outlining how we should better approach the health system in terms of implementing our interventions, we are caught in transitioning between the siloed interventions, the programmatic interventions, towards the life stage approach. And in the life stage approach, some of the strategies like IMCI, IYCF, which are cross-cutting nutrition interventions, we have issues in terms of at the national level who will be held accountable in terms of the implementation, given that the outcomes is also shared. So we are now working closely with the Safe Motherhood Program, the maternal and nutrition for maternal and nutrition interventions, with the adolescent health program for the preconception care, and then we are trying to revive the implementation of EO 51, enforcing it, and improving optimal IYCF practices so that we can actually totally achieve the goal of stunting reduction by 2028. So that's all from the health sector. Thank you.
Thank you, Jen, for sharing with us what DOH is currently doing, and echoing what Dr. Mian said about the disconnect and fragmented policies that we have from the national to the local level. So bottom line, there's a need for a strong political will of our local leaders, right? So at this point, I'd like to ask the reaction of Lyle and Dr. Val on the keynotes or pointers that was shared by our discussants.
The comment of Alice about the challenge in measuring the spending both of the national and local government levels, and we really struggled in really understanding how much is our investment for nutrition and whether we are investing on the right intervention, right? So the challenge is we had a struggle in estimating how much the national government how much the national government spending for nutrition, and if you go at the local level, you don't have any information on that, right? So, and I think that was the challenge, for example, in chapter 5, when we tried to understand how much are we really spending for health and nutrition, right? But I think one of our work at PIDS, and I think in chapter 2 or 3, is really coming up with a framework on how to better tag and monitor our spending at the national government level. And what we've seen is really most of our investments are not towards cost-effective interventions, but mostly towards, sorry for my term, but highly political type of interventions. And we don't know whether these interventions are really making a difference, right? So I think we have already developed a framework for the national government agencies so they can actually tag for the DBM, for example, to tag how much are really spending at the national level. But at the local government level, we are still struggling, and we try to do that by looking at several local government units or municipalities and cities. And we've seen large variation in spending, right? And some local governments spend on cost-effective interventions, some are spending on not so cost-effective interventions. So again, that variation in practice is really, really apparent across the country. So yeah, and maybe I'll give the mic to Lyle about nutrition financing and budget tagging, because he led the development of the budget tagging framework for the national government.
Thank you, Dr. Val. Thank you for the insight. So about the nutrition financing, yes, echoing that in chapter 3 of the book, so we've discussed there the nutrition financing, but that's only limited for now for 2017 to 2019 years because of the exact reason. It's very hard to retroactively track the nutrition investments because our current financial management systems does not easily allow this, and we had to do a post hoc manual tagging of each line item in each agency's financial documents. So in the previous work of PIDS, supported by UNICEF, we were able to come up with this tagging typology on how we can easily do this, and hopefully will be embedded internally in the systems that we are using through, of course, the help of the National Nutrition Council. So just to add further insights into the discussion, I'd like just to re-echo again our main message from the presentations that we are seeing improvements in the stunting prevalence. We are seeing our transition to an upper middle income countries. We have the resources, but again, we should be able to allocate these interventions to what is right, or what should we spend on in terms of interventions, because if these inequalities persist, we may see improvements at the aggregate number of the stunting prevalence, but still when we dig deeper and see it's the breakdown between the poor and the rich households, we see the large disparity, and we will not see the challenges experienced by the last mile areas, the poorest population, if this is not gonna be focused on. So that's it.
Thank you for expanding that explanation, Lyle, and Dr. Val for commenting on the recommendations of our discussants. So for better appreciation of the book, we have here on the both sides of the function hall the posters. That's the summarized chapter of the book that we will be distributing after the program. So after the program, you may want to check out those posters for better view of what the book contains. Okay. So after hearing the insights of our discussants and our presenters, let's start the open forum by zooming in a bit. Okay, in a while, sir, I will be calling your name in a while. So both chapters we heard today paint a sobering picture that economic growth hasn't fixed malnutrition, and inequality continues to drive stunting as what Alice shared with us, right? The poorer families get poorer because of malnutrition. However, they also demonstrate that solutions exist. No? If we can align systems, financing, and of course, strong political will. So I'd like to ask this first question to all discussants. The book advocates for a comprehensive, continuous, and convergent, or 3Cs approach. In real terms, how do we operationalize this convergence? What needs to happen so that WASH, health, food systems, and social protection no longer work in silos? I believe Jen mentioned it a while ago about working in silos. I'd like to start with Alice.
Yeah, no, thank you. Thank you for a very good question. I think to start with, I would see at the national level, we already have the PIPAN at the planning stage, right? So that's a very good framework already. It kind of identifies what is the nutrition specific, nutrition sensitive interventions. One thing at the national level that would be critical is to understand each sector is able to also include their interventions in their sector specific plans. And just emphasizing that, as you know, we have a situation whereby sometimes interventions are based on what the agency is doing rather than based on what is evidence-based within the first 1,000 days. So we have the first 1,000 days that highlights what these interventions are evidence-based should be. So once we have that in the specific agencies and they are costed, I think that would be some way of trying to bring everything together in the planning. And at the same time, we are at the national level, there's that accountability of being able to regular review plan in terms of planning. When you go to the sub-national level, I think it's, again, we have local nutrition action plans, but also emphasizing to the extent that each of the sectors at the local level is able to come together. Yes, the planning is done, but also the implementation, it's actually accountable within their own sector mandate. And usually having budgets or making sure there's a budget that can keep you on track. I keep going back to financing because that holds people accountable to some extent. I just want to highlight, I think, something which is quite important, which is a good lesson learned. What with the PMNP is what is being called the household convergence scorecard, which is a very good thing that is being learned at the moment, whereby all first 1,000 days, the Department of Health is trying to test at the household level. These are the interventions we know are high impact, but barangay and the barangay community workers can track that each household with a pregnant woman or a child up to 2 years receives these interventions. Now, that's a very good lesson. I hope that we can be able to sustain it and even scale up based on the lessons that are being done, because it means you're able to see, yes, the child should get breastfeeding, micronutrient supplementation, they should have clean water, sanitary environment. If they are poor household, they're in the social protection program. So there's somebody tracking that at the household level. I think we have to do it from bottom up. Yes, plans are good because there's that accountability for money, but then now the interventions are on the ground. Are we tracking them? Are we making sure that that household receives that interventions? Thank you.
Dr. Val? You have something
Okay.
to share?
I totally agree with Alice. But before I can answer that question, I also want to re-echo what Dr. Mian was saying a while ago, that there is no single intervention that could address stunting. I think we should start from there. And I think the easy political question is that, okay, we can just give maybe one intervention, like a sporadic intervention, maybe a bread or I don't know, but
Feeding program.
a feeding program, but that is not why we have stunting. Remember that stunting is an accumulation of stresses, starting from the womb until the second birthday to the third birthday. So if the child or the fetus experiences that stress from the womb, then and his or her first birthday, because of infection, because of lack of high protein or high diet, then you see stunting. It's an accumulation of different stresses, right? So there is no single intervention that could address stunting. And that's how we fail as a country, because when your system doesn't allow you to provide that comprehensive service for that critical period, then you see stunting, right? So it's a constant exposure to different stresses, right? So the question now, which leads to your, and I'll try to answer that question, is that how do we provide that continuous comprehensive service to a child? And that is
And the
a-
mother.
and the mother during that critical period. And to me, we've been arguing that the only one of the most feasible way to do that is through a strong primary care, right? Because a strong primary care will allow the mother and the child to have a constant access to health
Healthcare.
and nutrition services. So once we do not strengthen primary care and we invest so much on sporadic, how do I say it? Sporadic
Band-aid solution.
Band-aid solution, then I think we will always fail in that aspect, right? Because if you look at a lot of our health intervention that requires constant how do I say it? Like constant exposure to the health system or to institutions, we always fail. That's true for TB, that's for HIV, because we don't have that very well-defined institutions and system that allows women, children, parents to have a constant access. So again, it's a stronger primary care is there to me is critical in this area. And we've been arguing that I think in 2020 that we need to strengthen primary care, and strengthening primary care, the role of PhilHealth, right? To provide a comprehensive benefit that will give mothers and children or infants to have access to these critical interventions, right? So, but what is the role of PhilHealth and strong primary healthcare in this area? So, but I guess it's not really part of the discussion. But we should, because I think that would be a very important aspect in all of this in addressing malnutrition, building institutions and building systems. So if we keep fragmenting it, then I don't know, we will always fail. I think that's my assessment, but I totally agree that, you know, we also need to harness different agency, but within the health sector, there's already that institution that we could build on. I don't know, that's my take.
Thank
And
you,
we've
Dr.
written
Bob.
something like that in 2020 about primary care and how it could address nutrition.
Dr. Mian, your thoughts, please, as an advocate.
My thought would be, saan ba ang venue ng discussions? And we have that agency for the discussions, and that's the National Nutrition Council. A governing board convened regularly with all the agencies there, DOH, DSWD, DepEd, DA is also there, tama? Idagdag na natin ng DNR kung kailangan.
For the environment.
DNR, exactly, because of climate resilience
Climate resilience.
issues now and our disaster proneness. I'm sure I'm missing the ILG,
Yeah, for local government.
especially with links to education.
Mhm.
Yeah, so we have the agency that's responsible for convening decision makers for the discussions on PPAN, for accountability, for reporting outcomes of supposedly interventions that really matter and interventions that are delivered at the right time. I think that's where a lot of what we're missing is the timeliness of our interventions for our children.
Are we late? Not yet. We're not late.
Not yet.
Okay.
No.
The DOH is beside you, ma'am. Any thoughts on what has been said?
So the DOH sits as a member of the NNC, but the secretary is also the chair of the governing board. But I totally agree with what Doc Mian said. So aside from utilizing or maximizing these existing platforms to convene all the sectors concerned in addressing stunting, I also want to highlight the need for demanding accountability for the other sectors. So most of the reports that are being reported by the council is actually more on the interventions from the health sector. So if you ask how are we demanding accountability from, well, DOH and the SWD, but in terms of the other sectors, Department of Agriculture in ensuring accessibility of food, the high quality produce that we need to ensure that the citizens are able to consume these healthy food at the end of the day. That's missing in the picture. And then the accountability also in terms of enforcing existing laws and the violations of the other national government agencies. These, the council is actually the best venue to address all these things. And being able to leverage that, we need someone who will chair or who will sit in the council and make and really demand this accountability across the other agencies. And right now it's a headless council. So we're hoping that soon there will be someone who will be seated in the council and will be able to actually demand that accountability from the other agencies.
I'm beginning to have an allergic to accountability. The word accountability. Okay, thank you for those valuable insights and for answering my first question so to trigger the discussion. Now, I would like to open the floor for questions or comments from our audience participants, whether in person or online. Please, sir, introduce yourself briefly and state your organization and direct your question to a particular
Yes.
panelist
Hello,
or
thank you.
speaker.
My name is Alex Escucha. I'm a retired banker, but I'm a past president of the Philippine Economic Society.
Welcome, sir.
20 years ago, and 3-4 years ago, Dr. Tuanyo was also the president. I'm also chair of the UP Visayas Foundation, so we're looking at these issues. To premise my question, I would like to have a few sentences. One is Aristotle once said, the aim of all knowledge is action. And Stephen Covey says in the 7 principles of highly effective people, begin with the end in mind. Okay. Begin with the end in mind. Okay. In my columns in the business world and my guestings in TV, I commended President BBM for being the first president in recent memory to actually acknowledge in his SONA, the first 2 SONAs, malnutrition as an issue. However, what I'm missing in all of these in these studies, in these discussions, even in his SONA, was the lack of a bold target. Because as the World Bank statistics show, all the other countries, their malnutrition, whatever you call it, stunting or wasting, has declined. Tayo na lang naiwan, so we're now number 1. Yeah, we're now the worst. Okay. So what I'm calling for is that the president should call for if we are at 30%, which is the baseline for the 2023 to 2028 Philippine Development Plan as of 2019. Unfortunately, there is no target for the reduction. There should be, say, I'm wearing my hat also as a corporate planning practitioner, where you begin with the end in mind. Okay, let's reduce this from 30% to say 10% before the end of my term. And then the next question is, what should be done, what needs to be done, and what kind of resources needs to be deployed at which point of the ecosystem or the value chain, whatever you define it. Because I found that, we improved. That's why, with apologies to the Department of Health representative, I am really appalled when they say we're making progress, we're in the right direction, but very minimal. Or when the DepEd or even the EDCOM will say, our education system is resilient. That's a much abused term. In fact, we should all be, Val, you mentioned it is a crisis. It is a curse, right? So there's the sense of urgency in terms of target setting does not match. So this is a soliloquy, but precisely what I'm posing as a challenge, because even in the references, I was looking for whether you have referenced Dr. James Heckman of the University of Chicago, who won the Nobel Prize in 2000. His work is again from age 0 to 3. Or the work of Nobel Prize winner for 2010, husband and wife team of Abhijit Banerjee and Esther Duflo of MIT, where they actually conducted double-blind studies where to say which interventions work and which does not. Because Kyle, I'm very disappointed to say you have all of these studies and yet your conclusion is it's not conclusive. No, so we really look at say exactly what do we need to do. So from my point as a strategic planner, because the other phrase I'm very allergic to is we will implement a whole of government approach or a whole of society. It's obvious that they're not talking to each other. Precisely,
They
diba?
don't have a
So if you have
conscience.
that master plan, this is the goal, this is what needs to be done. What does each of these agencies need to do in each of these areas of intervention? Because as you said, that triple C, comprehensive, consistent, then that is what I'm missing. And it is very conspicuous by its absence. So I'm stating a frustration because I think there should be more into that. Not just enough that we should devote more resources. How much? What is the goal? If you receive it, if you put it to zero, if you put it to 10%, or even the 91% learning poverty ratio of 91%, that's also the baseline for our Philippine development plan, to reduce it to say 40%. What will it take to do that? I think that's the only question that should drive everything, including the studies. Because otherwise, if you don't do it like that, my joke to Secretary Mina Pagandaman of DBM, we tweak here, we tweak there, and you don't resolve the issue at the end. Is that the equivalent of rearranging the chairs in the Titanic? So let's really address the real issue. Thank you very much.
Thank you for your insight, sir. I think Dr. Bal would want to respond to that.
Thank you for that question, sir. No, so actually we have a target for stunting, which is I think 2022. If in PPAN we have a target of 22. So I mean, but that's what they set. It's around 22%. So, but I think for the previous PPAN we didn't reach that level, right? That 22%, right? But if you ask me what would be the most feasible rate of decline in stunting, so for example, China and Vietnam, they were declining around 6% every year, and we were declining like 0 to 1% in the last 10 years. So if you want to be bold, when it comes to targets, then which we describe in the paper for China and Vietnam, because these are, and Peru, these are the stellar countries that have reduced stunting, right? Around 6% annually, right? So you can use that as a benchmark. But when it comes to target, we have target in PPAN, which is around 22%, and we failed to achieve that. And when it comes to solutions, there are already proven interventions from many countries, and we've highlighted that in the book. But the question is, are we able to implement that? And I think that is the question. I think most of the people in the health and nutrition sector, they know how to solve it. Like, these are the right intervention, but the problem is we cannot implement that religiously, and if we implement it, it varies across local governments. That's why it boils down again to implementation challenges. So I think that's my response to that. We have a target. There are already known cost-effective interventions, but the problem is we are not like able to fully implement these cost-effective interventions, right?
As
I don't know,
mentioned
like,
by
maybe
Alice a
Alice,
while
you-
back, we are really good planners.
Thank
but
you. Yeah, thank you. Thank you, Vala. And I fully agree. Yes. I think maybe just to add is also we are not investing. We know what should be done. We know very well this is the target. And I'm just going back to the point that we have not put the money to get us to that target. So I think there's a need for us to, okay, we know this is our plan. We know what should work. Now I think the target is 14%. For us to get to 14%, to get the level of reduction from China or Vietnam, then we need to pour money all the way, whether it's a local government unit, for the interventions that we have agreed and we know are evidence-based. So I fully agree. Are we putting in the right interventions? I'm not sure about that. So we need to put in the right intervention and make sure every mother and child receives this before their second birthday. Yeah.
Okay, thank you for clarifying that. Dr. Val, since we are on the topic, the book calls this as a chronic crisis, as mentioned by Sir a while back. But, chronic means it's preventable, right? Because you can predict it. So why isn't the predictability lead to better preparedness? What do you think is wrong with our system?
Ano, Ma'am Mian might want to answer.
Ma'am Mian.
Do you repeat the question
Okay.
para I can frame it?
The book calls this as a chronic crisis, and my assumption is that when you say chronic, it's preventable, right? Because you have seen the signs, the symptoms before it becomes chronic. Why wouldn't predict it and prepared for it?
We have the data and we keep on stressing
Yes.
evidence-based, evidence-based. Gosh, ang bigat ng question. I did allude to the fact that our interventions are not timely. They're misplaced, no? We're not addressing the roots in the intrauterine environment, even the early impact of harsh intrauterine environments on our children. We're spending so much money, but we're not accessing the right recipients. They're not in the school systems yet. For example, Indonesia was being lauded for their considerable reduction in stunting over the years 2018 to 2023. I can't quote the figures, but when I looked into the Global Children's Nutrition Foundation report of being global, they surveyed the school feeding programs in, I forgot how many countries, but they did describe, and they documented that Indonesia achieved this reduction without school feeding programs. Zero, when they tabulated across the countries how many students actually received food in schools, across all the rows from grades whatever, their entries were zero. At that time, that 2018 to 2023, I believe, they had not instituted a school feeding program yet. Ibig sabihin, that means that their recipients were in the homes, the mothers and the young children. I'm sure DepEd will be up in arms, but
Anyone from DepEd here? Oh, Dr. Hirin. You want to answer first?
I'll try to answer that, but I think I want to emphasize again the nature of stunting vis-a-vis the political structure, right? Because when you think about it, as I've mentioned a while ago, that stunting is a chronic condition. It's an accumulation of stresses. And for us to remove that stresses, you need to build systems and institutions for us to deliver and remove those constant stresses, right? Like you need to have a strong primary healthcare. You need to have strong local governments that deliver these services on a constant fashion, et cetera, et cetera. But the question is that delivery of these critical services aligns with the political structure of the country because the political structure is very short-sighted. Am I making sense? So, and to me, that is a reflection of, I'm saying it's a failure, but that's how it is, because we want like a fast delivery of these nutrition health services, but that's not how it works in malnutrition. It needs to have an institution that constantly provide these services. But when your political structure doesn't allow you to deliver that because it's fast-paced, you need to have the outcomes as soon as possible, then it's really a challenge. So how do you deliver a continuous or build a system that will allow you to provide that service, right? So I don't know if I answered your question, but that's, I think, my take on this. It's really building a system and an institution that provides these women or mothers and children the necessary intervention for this critical period. But yeah.
At yung sulit na intervention.
And a solid intervention.
Sulit.
Sulit.
A sulit intervention.
Sulit.
Sulit.
Right? Because if you only want to give intervention this week, then wala na next week, then it doesn't solve the problem. Right? So how do we build that system long term? Is really the key.
Dr. Hirin wants to say something.
Thank you. First, I'd like to congratulate the authors, the discussants. It's a very interesting topic. I just had a thought. Val presented income, nutrition. Lyle presented starting from governance to nutrition. And they're all correct structures. And I was thinking, as I went through the things that they mentioned, that also I was thinking about the title of the book, Raising the Bar. I was thinking perhaps we can, many of the answers to the questions can be answered by maybe changing the title a little bit by saying strengthening the links. And let me tell the story why that is so. First of all, income, nutrition. There's a long way to go from income to nutrition. That's why Val says our income is increasing. How come nutrition is not improving as much as we expect? And it got me to thinking, and this is the advantage of old age. You can go back as far back and
Institutional
remember,
memory.
except that you can't remember what just happened. But 35 years ago, the National Nutrition Council asked me to review the literature on nutrition. And one of the things that I found there, some of the statistical work that was done at that time, there was not even many longitudinal studies, but putting together pieces of cross-section information. One could put together the linkage between income and nutrition. And it goes something like this. With income, you have expenditures. So there's a leakage there. Expenditures, then food expenditures. Then we're moving closer. Food expenditures, household availability of food. And who gets the food? Then that's intra-household allocation. And there could be rules in how food is allocated between children and adults and so on. The so-called investment model or equity model. Now you already have the food. So food intake, we're closer to nutrition now. The next would be food, the nutrient absorption. So food intake, nutrient absorption. Nandun na sana tayo. except the child is sick or often sick. So the link is weakened that between intake and nutrient absorption. So that's what you have to think. The links in all of this thing, some are weakened by some of the other links and so on. So maybe we should also look at the links and looking at those numbers. I was mentioning this to then Secretary of Agriculture, Senen Bakani. And he was very quick. Mathematically, he looked at the elasticities and he said, yeah, that's terrible. A doubling of income would improve nutrition by only 5%. By going through all of those links, some are weakened by certain things. So that's why I thought about the links. Now, Lyle also mentioned all these links from governance all the way to nutrition. And governance, there was the PIPAN. And Alice mentioned something about planning. So we go from planning to nutrition. So how come we don't get good nutrition if we have good plans? Then that you're planning, your next one is financing. Again, 10 years ago, I did some estimates of nutrition expenditures. A large part, as you had found out, a large part of the expenditures are the so-called nutrition sensitive. But the nutrition sensitive, it got a long way to go before it has to translate into employment, income. And that is why also the social safety nets, like the 4Ps, it takes a long time before it can get to nutrition because there are so many links that it has to go through. And some of those links might be weak and so on. So perhaps if you can model something based on the numbers that we already have, just showing the links, and then let's use it to play again. What if we increase this link? If we strengthen this link, what would be the total effect? If this link, which is naturally strong, is weakened, what will be the effect? So that would be a nice game. So in effect, if that is correct, and we can play that game after you work out that thing. Maybe the next
volume.
volume, sir.
the next maybe the same data,
Friends from UNICEF,
with
we
a
have
different
volume 2
lens.
already.
Instead of raising the bar, strengthening the links.
Strengthening the links. Thank you
I
for
totally
sharing
agree
your
with sir. So
expertise,
thank you, sir, for that volume 2 po.
We have questions now from Christina Season from PSND. Christina, please go ahead.
Good morning. So first, I also want to reiterate what Dr. Mian mentioned about the dialogues. So for the past 2 years at least, we've had a lot of forums, seminars, workshops, where we talk about multi-sectoral participation in addressing malnutrition. And it's the same conversation over and over again. But one thing I noticed in these forums, there's an agency that's either absent, probably not invited, or parang nakalimutan. And the DILG, I always tell people, the DILG is an important department where we need to include them in this conversation because the local governments are the implementors. So even if it's just like this discussion now, we're talking a lot about governance. I'm not even sure if is NNC here or like what we mentioned, we have a headless agency now, but DILG would be that agency that, and now leading now to the political system that Dr. Val is reiterating. I'm not going to sugarcoat it. Yes, we need a political system that can really address malnutrition. And our current political system, and I'm going to say it's corrupt. So there's no sugarcoating there. And I think that's one reform that we really need to address. It's the elephant in the room. And we just say it out loud. It is what it is. And it's affecting how we implement programs. Flood control pa lang yan. So, but I just want to contextualize also what I want to ask. So Dr. Buwis has been analyzing the Howard Powys has been analyzing the FNRI data. But in the 80s, he and Lawrence Haddad did outcomes. Okay. But after 6 months, when you start introducing first food, that's where the difference comes in. It's very critical, and income still plays a factor on what kind of food you introduce during the 6 months, first food. And that's where the height for age gets affected again, right? It becomes stunting. That's where you can see na nagdi-decline yung stunting. Now, this is data from the 1980s. And then you do an analysis again based on the National Nutrition Survey. And it's the same trend. Okay? We're talking about the same thing. And in fact, in that analysis, he looked at decades of trends in stunting. There's a peak. In 2015, that was the highest prevalence of stunting. And then it gradually came down. And it's still gradually going down. So my question is, what happened in 2015? Why was it so high? And what's working? And that's my question, because that's what Dr. Val was asking, telling us earlier. Invest in programs that's working. Do we know what's working? Do we evaluate our interventions? Do we really know? And why are we putting in the same interventions in the PPAN? When do we know which ones are and are not working? Right? And then if you look at the national budget, we spend so much on national social protection, right? And the social protection, I would think, is a nutrition sensitive approach to nutrition, food and nutrition security. But even in your data, 4Ps is not really effective. So why are we putting in half of our national budget in social protection without really knowing? Maybe you can answer the question, do we know what's working?
Let's address the question to our guest from DOH. Any thoughts, ma'am, if it's working, or are you doing some evaluation of the PPAN? Because at the get-go, it's a good plan, as what was mentioned by Ms. Alice.
I think your chapter 7 is actually dedicated to the entire evaluation of the last edition or the version of the PPAN. And we have the ongoing PPAN that we will be evaluating sometime after 2028. So is it working? Is the PPAN working? We can say yes, that it is working, but with what you mentioned earlier, the recurring themes, the recurring trends, it's actually because the way we are operating has not actually changed over the years. We agree with the recommendation of Sir Val that while we push for primary care services, strengthening the primary care interventions, the problem is that in as much as the national government can pour out these resources to ensure that primary care services are functioning, are accessible, the people are actually not accessing it. So it's the intergenerational cycle has to be cut or addressed at some point, and we're seeing that the preconception and the maternal nutrition is the aspect that we are actually lacking now. In terms of addressing malnutrition in children under 5, we're doing really well. But in terms of addressing those that are nutritionally at risk during pregnancy and even before that, that's something that is we're doing something on it now, but I think this is relatively old and new at the same time. We only appreciate maternal because we wanna reduce mortalities, but in terms of ensuring the proper nutrition of our adolescent girls, ensuring that they are actually ready to conceive, and they are conceiving at the right time, at the right age. This is something that is beyond the health sector, and it should be addressed at the ground. And it entails a lot of government agencies, not just the Department of Health. But in terms of the work that we are doing, we are making progress, like what the book actually mentioned, but it has to be multi-sectoral, not only at the national level with the NNC, but even at the local level. So,
Dr. Balwan.
I'll try to answer this and maybe Alice could supplement. So I think we need to diagnose the problem because we need to separate technical and adaptive, right? When you say technical, is that we know what works. We know that we know the nutrition specific interventions that should a mother and a child receive for them for the child not to be stunted. We know the intervention. The Lancet already listed down all the intervention. So that is the technical challenge is already answered. We know the intervention that works. The next question is the adaptive challenge, right? That we cannot implement these cost-effective intervention, right? So we know the intervention already. It's already listed down in the adaptive challenge. We cannot
Clarify, we know technically we know,
Yeah.
diba? Pero in terms of the actual interventions that are being implemented, which have had real impact on nutrition, that we can continue and sustain. We know the technical part. All of
Yeah.
us here know that. But do we really evaluate? Do we analyze for impact, that we retain what's really working and take out what's not, and then invest on what's really working? You can.
Alice have some
No,
insights?
thank you. Yeah, I just wanted to add a little bit in the sense that, yes, nutrition specific, we know it works. I agree with you. We probably don't have the evidence on what is the coverage, because what the Lancet tells us is that if you implement at 90% coverage, then you will see a reduction. We don't know, we don't have data. You know, if you look at the routine data we are collecting, the FHSIS, we don't really have routine data to tell us vitamin A supplementation is 90%, MMS is this, right? That is a challenge. So we don't know if it's, whether it's really those interventions are helping to reach to stunting reduction. Second point I wanted to say on nutrition sensitive interventions, I think we have a failure sometimes in the sense that if a nutrition sensitive intervention needs to work, it has to be targeted to the first 1,000 days. And I'm going back to the point, yes, we have education related interventions. If we want to put nutrition sensitive, then they have to be for 0 to 2 years. Maybe it's a pregnant mother, or it could be, right? The same, the 4-piece program. Is it targeting the poor household within pregnancy and 2 years? That's another question for us to see. And when it targets, what intervention is delivered? That's when you can call it a nutrition sensitive intervention. If you do a 4-piece program, yes, it will have impact on other things, but not nutrition. Likewise, when we say water and sanitation, yes, it's important. Everybody needs to have clean water, but do these beneficiaries, do the pregnant mother or young children? I think sometimes the failure is that, are we targeting the right households that should actually benefit for us to prevent stunting? Yeah.
Thank you for answering that. We still have one question. No? It's from Maria Lourdes Vega of Nutrition Foundation.
Yeah, thank you. Good morning, everyone. My question is, we say we know what have to be invested on? Do the local government units know? Do they know that, well, we've been working with Iloilo province on local nutrition planning and trying to increase investments. The critical investment points do not seem to be clear. We know, for example, we looked at what call this, the optimization tool. It says micronutrient supplementation, but that is nationally funded. All the others, we couldn't pin it down to the LGU level. So maybe that's one important thing. I appreciate convergence. We've talked about convergence since CPC2, I think. And I think convergence really means looking at the family, looking at the child, and checking what services are being delivered to that family and identifying who should take care of it. It's easy said. It's very easy to think about it that way. I know that PMNP is trying to test a system, but I heard the BHW or the worker will track. What we heard from a team of Filipinos who went to Colombia to look at the ECCD program was, what I understood from the feedback was, at the community level, there's a group of workers and they look at each member of the community who is in the ECCD stage. And then they determine, ano yung kulang, what is missing. So, for example, in this household, the mother does not go to prenatal care. So the health worker is assigned to follow up that mother. And the next time they meet, that healthcare worker is asked what happened. I don't know if that is at all possible in our context. But I think, kasi yung multi-sectoral approach, let me tell you, I was studying in the 1970s. Multi-sectoral approach was like, it was put in our minds that nutrition has to be multi-sectoral.
Allergy na rin
We say it, we believe in it, but we need to have systems that will make it work. The planning system, I think we try, but you see, like, for example, what I've seen is in one city, they wanted to put, so they want to have nutrition sensitive agriculture. They dump all their agriculture programs. That's not how it should work, right? So maybe there's a system for helping LGUs determine how to make their programs nutrition sensitive. I also don't know.
We don't have anyone
It's
from the
it's
ILG
really
here.
hard.
No.
But yeah, she can only do so much, really. At most, it will just issue their
Memo
their
circular.
random circulars. Very difficult to ask them to. It's really capacitating things and fixing things at the local level. Universal healthcare, primary healthcare. There is no nutritionist in the primary healthcare team. That has to be looked into. Is it not important? Can the doctors, nurses, and midwives handle nutrition services at the primary care level? So I think that's one thing we should think about. How do you really make convergence work at the community level? The other thing is complementary feeding. Complementary feeding has been pangit all this time. And we need, I think it's not, the intervention is not giving food, but it's really a behavior change communication that is serious and sustained. Because even before, it was really complementary feeding that was really not so good. So something has got to be done about it. And BCC really, face-to-face really, this would be capacitating our workers. So we talk about, ito pinag-usapan namin nila Dr. Mian, we have breastfeeding support groups, we call them IYCF support groups, but they need to be supported and they're not being supported. So, I mean, yeah, systems, but sana mas focused and yeah, trying to find yung mga big wins, yung mga immediate na pwedeng magawa. Yun lang.
Thank you, ma'am. So who wants to answer the first question more on the LGU familiarity of these issues? Who can try? Do we have
But-
data? DOA?
Well, basically, the structure of the NNC is being replicated at the regional down to the LGU level. So in terms of planning and implementation, we have our local nutrition plans. I'm answering on behalf of NNC. But again, it's an issue of implementation. So we are very good planners, but at the end of the day, again, in the same way that we should be demanding accountability at the national, there should be some form of accountability also when it comes to the plans that they are developing, because based on, I'm not sure if it's the PMNP baseline assessment also that pointed to the plans being a perfunctory product of the annual or mid-year planning that they have to do. But in terms of ensuring that these are being implemented, the demand for that is actually unclear. So the plans are there, the interventions are there. Is it being funded? Yes, definitely, because they have to submit that report for them to be acknowledged at the national level. But in terms of implementation, again, we go back to the local level implementation being an issue, and the sectors can only do so much to influence how the local governments who are independent of our interventions at the end of the day in terms of implementing what they have actually planned in these documents.
Are you saying, ma'am, that there is a nutritionist at every local government units?
And some LGUs, they are actually designate. So it can be a nurse, a midwife doing the designate role of the nutrition action officer.
I think the answer to that question is if you read the chapter, is it 4, about the local governments. So the answer to that is actually hindi. It's because you will see large variation in nutrition spending among local governments, right? Second is that if you look at their spending, they're spending on different things. Some will spend on nutrition sensitive, some will not, they will never spend on nutrition specific. So to answer that question, there's huge variation in practices among local governments. So in terms, so we don't know. So magkakaiba talaga. So there's a large variation. But I think the question is like what would be the role of the national government? Ano yung leverage nila so that it will police the local government to invest on nutrition or to invest in cost-effective intervention? So parang what is the role now of the national government? How could they leverage their power, right? So yun, parang how do we use national resources to not force local government to spend on the right things, right? So yun. So I think those things need to be kind of discussed, right?
There's another question about complementary feeding. Who wants to answer that part? Dr. Mian, you want to answer about the complementary feeding? Is it helping?
Actually, yung di ba, Ma'am Didi, in the 2023 key findings, the indicators for complementary feeding actually improved, though slightly. But at least it's in the right direction. All the 4 breastfeeding indicators went down. So wala yung continuum sana
Hindi
na.
na pagpatuloy.
Yeah.
Okay. Okay naman.
No, no.
We have one question from Facebook I would like to address this muna, no? From Miss Margarita Resi Guerrero Hilario. What is the best approach or intervention in translating data into programs that is effective and sustainable to attain food security? I'd like to ask your global perspective from Alice. Question is, what is the best approach or intervention in translating data into programs that is effective and sustainable to attain food security?
Yeah, no, thank you. Thank you for that. Maybe I'll twist a little bit the question, because there's 2 things around attaining food security and actually making sure that children have the right diets. I mean, those are 2 different things, because you could be food secure, but whether it's diversified. So sometimes we say nutrition and nutrition security, and food security. So I think some of the key things, which I'll also tie to the question previously on complementary feeding, in the sense that attaining food security or optimal diets means that the country is able to produce and make sure that what is accessible is diversified. So production is one thing. And I think there's no problem. If you look at the chapter around food systems, the challenge is not really about production. It's access in terms of nutritious and diversified food. You also see there are challenges around whether families can access more fruits, vegetables, high quality protein for their families. So for various reasons, it could be supply chain related issues. It could be the cost, of course, which is more in terms of the movement of food from one region to another. So, and that is what converts to children being able to eating more the ultra processed or unhealthy diets. So again, connecting it for us to have good complementary foods, I connect it to if you look at the minimum acceptable diet, it means it's stayed at 13%, 13.8%, because families cannot access diversified nutritious food. So food security is one thing, but getting it to be translated to diets of young children, that's a longer process. So there are issues around subsidizing nutritious diets for families. So I agree also with Mam Didi, it's not about giving a product. It's not about whether it's, not to mention any names, but giving the product will not help. There's also behavior change. There's also supporting families to access these foods. The role of agriculture and food systems in helping families. Again, it's not production. Families, 0 pregnant women, up to 2 years for us to see the impact. Yeah, thank you.
Thank you for answering that, Alice. We have another one from Ismael Transmonte Jr. This is via Facebook. How can we reduce the dependence of local nutrition programs on the orientation of individual LGU officials? Can national policies or incentives be introduced to address unpredictable LGU orientation in addressing malnutrition at sub-national level? Dr. Mian, would you like to comment on that, since you're a longtime advocate, knowing the landscape? How can we reduce the dependence of local nutrition programs on the orientation of individual LGU officials? Can national policies or incentives be introduced to address unpredictable LGU orientation in addressing malnutrition at sub-national level?
I don't know if this will be okay. So I think even though the Philippines, if you look at the system in the Philippines, it's highly decentralized, right? So we depend so much on the local governments to deliver these health and nutrition intervention. But I always believe that the national government has leverage to not compel, but shape the behavior of local governments, right? So for example, providing matching grants, for example, to local governments if they deliver these kinds of cost-effective interventions, right? So because currently what we have now, the relationship of the national and local government is very passive, right? So what if we make it more active, meaning that we provide resources based on a certain performance, right? So that's one thing, like shaping the behavior of the local governments through these grants, right? And measuring their performance. Second is it could be through earmarking, for example. In Indonesia, for example, they allow local government to spend 5% of the transfer to, for these kinds of specific intervention. So I think those are mechanisms that could be used by the national government to shape the behavior of the local government. So, and proper monitoring their performance is critical. And this is the role of the National Nutrition Council comes in, right? I think the question for NNC, wala sila dito. So do they even monitor the performance of local governments, right? So do they have data, for example, to monitor the performance? Do they even know how much they spend for nutrition? Because as far as we know, there is no current data on how much the local government are spending for a specific type of intervention for nutrition. So those things are, I think, the low-hanging fruit that the national governments could use to shape the behaviors of local governments so that they will spend on the right interventions. But because the current relationship is very passive, we're just monitoring them. Monitoring them for what, right? And we just compile them if there are reports. But we can make it more active. How? Because we have the leverage, the fiscal the fiscal leverage to do that. So I think that's how I see it. It's possible.
Dr. Mian, want to
Alice
add
and I were
something?
asking historically, how did GAD, Gender and Development,
Gender development, the 5%.
secure a 5% earmark?
Yeah, it's passed by law, right? With the PCW. If they were able to do that,
Because
we were saying
in practice, we tap into the GAD funds, but we should have our own.
legislation. Okay. I think I saw two hands a while back. One lady over there wearing blue. Come, ma'am. And then another one from sir. Because of short time, is it okay if you keep your comments short as well?
Sige, I'm Alma Gamad. I'm the City Nutrition Action Officer of Makati. No? Fortunately or unfortunately, only 3 cities are here. Quezon City, Pasig, and Makati. No? I just would like to share with you kasi nga the bottom line of improving stunting will be the implementers or the local government. But then, let me just share with you some of the MOBs or the verification, no, for indicators for stunting. One, there's no indicator even for health in stunting. It's PMAM. It's the waist for length, no. So if we have more stunted children, later on they will go horizontally, not vertically. So mas marami tayong overweight and obesity. Okay? The only indicator that we have right now is OPT. Okay? Tapos dun kino-compare every year. And then the next one is, what is the thing that would engage the local government or executive legislative agenda? One is to look at the local chief executive plan, if malnutrition is there in the plan. The second one is only the MELP, the monitoring and evaluation for local level plan, is the gauge for improving because they are being given the awards for nutrition. But then there are also comments na how come the other local governments are not improving whereas they are awarded in the MELP in terms of financial. So at the macro level, with that, we cannot really relate more of the macro indicators. But in the micro level, it's true that DILG will be the ones that will monitor the local level. But then it has to be in the comprehensive development plan of the city to reduce malnutrition. So if it is 22% in the national capital region, the stunting is just 1 to less than 1%. So is it really because this is the highly urbanized areas compared to the other provinces? So that thing will be in terms of looking into the other indicators. No? The other thing is chronic malnutrition is the end result of malnutrition. That's why the thinning of bones will never store any minerals and vitamins, so they cannot grow. Okay. Then the other thing is after 23 months, the next one that they will have spurt for a normal height will be during pre-adolescent. Pag nag-menarche, pag secondary characteristics na, no? And that should be also part of their in terms of looking into the health and other nutrition factor. And the other thing is the only pregnancy indicator is BMI in the first trimester. So if you try to look at low birth weight, the low birth weight is more controlled by the third trimester. So even if we invest in micronutrient, that will never increase the weight of the mother. But probably the anemia will be solved, and that will also, in the end, will also improve the birth outcome. But then, kasi it's always said that we have to invest, like for now, no, the iron are being purchased by the local government, but it's really very expensive. Okay, the food, if we improve in nutrition in terms of looking into the diet diversity, I think that will give us more chances of looking into the stunting. And then if you try to look at ENS, the National Nutrition Survey, even at the first 6 months, ang dami ng stunting. So saan galing yan? Sa birth weight. Okay? And then the next one, so you're talking about complementary feeding. Is it really the time when they change diet na nagko-complementary? What about as presented kanina, there are many very high diarrhea cases which will also engage into stunting eh. Pero what about if we have low diarrheal cases, but there's also stunting? So more of the basic under the book are on basic causes, no? Pero yung intervening factor in between the ages, maybe we can look at that, no? So whether you change the title of the book or not, what we're more interested in terms of how these things pulled together as a package for stunting will be improving really the prevalence. No? Kasi right now, the prevalence is very high in stunting for Metro Manila and very high on overweight and obesity. So if the two variables indicators will go together, our children are growing horizontally kasi maliliit sila and then not vertically. No? Like for example, in Thailand, ang vision nila is taller children. What about our vision? Wala naman nagbi-vision ng ganun dito sa Pilipinas. Kasi hindi rin kami pwedeng magsalita dahil kung ang mayor namin maliit pero matalino, paano nyo gagawin yan? I'm sorry for those na foreigners.
Thank you
pero
so
hindi yan.
much, ma'am, for sharing your insights for Book 2. We will have Book 2. Sir, you're raising your hand a while back.
Thank you again. My suggestion for book 2 is to be bolder than what Ma'am Ian says. It should be a bold target to reducing and eliminating malnutrition because that's the real goal, diba? But talking about resource, because I'm citing 2 studies. 3 years ago, when PIDS Dr. Justin Jokno Sikat was president of the PES, she did a study on the devolution from the Mandanas ruling. And we're saying that because up to 40% of our fiscal space actually at the national level is getting limited, no? Aside from the military pensions and the LGU. But her study said that at that time, 55% of the LGUs do not have the institutional capacity to plan and implement the programs. Last year, at the keynote session of the Philippine Economic Society, former Yusek Sarmiento basically gave the reality that at the LGU level, the composition of whoever is the municipal development planning office are really just composed of not really the experts, but really just the political allies and supporters of whoever is the LGU head. That's the reality, no? So I think since we are about reality, sinabi mo, Val, di ba? What part of the solution, this is what it takes to do that, how to capacitate them. And then last year, there was a session, a sub-session on devolution headed by Yusek Capuno of NEDA, that the finding there is that they're trying to, because they cannot just, the LGUs have the resources, but they don't have the capacity. Naiingit nga ako sa city in Quezon City, Makati, because the irony is that the LGUs which needed assistance the most have the least resources and they have the worst problems. Your report, even the World Bank report on poverty and inequality, says that the worst poverty and inequality and malnutrition is in Barm, for example, or Southern Mindanao, di ba? So I was looking forward to whether any of the participants here have actually say, why don't you pilot an intervention program where in the areas where that needed it most? Because if you're talking about devolution and Makati is already, they not only have the resources, they have the people who know what to do. But what about those in Barm and where they really literally have no resources and no institutional capacity to do that? Because it's so easy to say general statements, but if you really want to have, say, intervention in this particular area, then what is the result after 1 year or 2 years? Then if it works, then that can be scaled up to the rest of the country. Perhaps that's an approach that you could
Thank
look
you.
at. Thank
That's for book 2. We are recording all of your suggestions, and we will be considering that as Doc Val will be editing and writing again for book 2. We have another question, last one from the lady at the back.
Good morning po. I'm Irene Dagami from UP Diliman. So I briefly worked in the LGU as well and Leyte and Samar. So I focused on Western Samar po. So one of the perennial problems in the ground is actually the barangay nutrition scholars. So currently we have PD 1569, but it's not updated. So majority of BNSs, they are the frontliners, but they are only given allowances of 500 pesos to 1,000 per month. So considering that, plus they have no protection. So that's one of the problems in terms of the delivery on the ground of nutrition services. So actually, they're not only nutrition services, it includes health services as well. So what are we doing for them? Especially, they are very important in everything that we do. Yeah, so that's all.
Thank you for raising that up. I guess Miss Jen from DOH can answer the.
Okay, so in terms of the BNSs, their allowances and their protection, actually the NNC has passed, Ma'am Didi, are you still there? Has already passed several bills to, secure the tenure of these individuals, and they have, I think, developed a module with TESDA, so that in a way they will be professionalized moving forward. But at the end of the day, with the BNSs, being constantly, changed with the changing governance on the ground also. So they also fall victim to that. So, and the houses, I think several years ago, they've already submitted not just 1 or 2 bills to support the professionalization of our volunteer workers. But yeah, we still need to ask what happened to those house bills, no? So, but we at the DOH and then the NNC, I think they already have submitted all those requests for legislations. And I also have to mention that it's not just the BNSs. So going back to the discussions earlier regarding the importance of primary healthcare services, we also have our barangay health workers and our deployed personnel who are actually helping alongside them in addressing our health and nutrition concerns on the ground.
Thank you, Ms. Jen. So we've come to the final.
The
Oh, you want to add some more, ma'am?
The bill for PHWs did not pass after the third reading. So
It didn't
For
pass.
the BHW.
So we need to advocate more. All right. Thank you. So another policy recommendation, Doc Val? Okay, so we've come to the final stretch of our program. I'd like to invite each of our panel members here to give us, including you, to give us a very, very short message, one sentence or two, on what means for us to raise the bar in the Philippines in terms of addressing chronic malnutrition. I'd like to start with Ms. Alice. Quick message for everyone.
I think it's working together at all. I know it might sound a bit cliche, but it's really genuinely working together at all level, from up to barangay level, mainly because the causes of malnutrition are multi-sectoral. We know that, but I think the main thing is about making that conscious decision with investment to be able to work together and empowering that system at that particular time to work together and achieve the results that we are looking for. Thank you.
Thank you, Alice. Dr. Mayan.
Policy coherence.
Ms. Jen.
For echoing, empowering LGUs and strengthening their local health systems.
Thank you.
I
Lyle?
would be re-echoing again the central message, which is addressing the inequalities and pouring all our investments to those who need it the most.
Thank you. Dr. Val? And in preparation for book 2?
No, it's about, I think, properly measuring the state of affairs. I think that's very important. If we don't measure it properly, we don't, we cannot manage the problem. And that's what we've been trying to do, is to really provide more data, do more analysis so we can have a better understanding of the problem. So, yeah.
Thank you. Well said. Before we leave the stage, we will have a photo opportunity, okay, with all of our panel members. Thank you very much to our panel members for your reflections and insights today, and to our audience. Sobrang engaging ang topic natin. Lampas isang oras ako nakatayo dito. Thank you. What we've heard today is both a challenge and a call to action. The future of Filipino children will not be secure only through economic growth, as what has been presented. It will depend on how boldly we confront inequality, how coherently we govern, and how persistently we invest in the first 1,000 days of life. So on behalf of PIDS and UNICEF, we thank you for participating in this very important conversation. Please let us continue raising the bar, not just in policy, but in practice. Implementation is very important. So I'm now turning the floor back to Louis so we can move forward with the rest of the program.
Thank you very much, Ma'am Mel. And you're right indeed. It was a very fruitful discussion. Now, moving forward, to formally close the program, may we call on Dr. Miguel Carlo Dino, Medical Officer 3 from the Department of Health, to deliver the closing remarks on behalf of Dr. Ana Marie Selina Garfin, Director 4 of the DOH's Disease Prevention and Control Bureau.
Hello, good morning, good day. Good day to our distinguished partners, the Philippine Institute for Development Studies and UNICEF Philippines, esteemed colleagues, researchers, policymakers, and friends. Today, we officially launched the Raising the Bar, Understanding and Solving Chronic Malnutrition in the Philippines. And in doing so, we have officially set the bar for the national discourse on child nutrition, but we reflect on the insights presented. We realize an important truth. It is not enough to simply set the bar high. We should collectively commit to raising the bar higher. So the core message is resonating from every page of this publication clear. We cannot approach child malnutrition with one-track mind. It confirms that we intuitively know chronic malnutrition is never a simple issue. It is a profound symptom rooted in complex factors, including social equity, the health of our food systems, reliable access to basic human needs like clean water and sanitation. Seeing this full complex landscape is not meant to overwhelm us. Rather, it empowers us by clarifying that the solution requires a coordinated effort, ensuring that every sector and every policy we touch contributes significantly to our children's health and well-being. It is also challenges us to look beyond numbers and outcomes, and instead confront the systems and structures that shape these determinants, from public spending and social protection to the review and strengthening of our national strategic plans. We recognize that tackling the determinants of health is paramount to preventing diseases, and this is no greater priority than protecting the long-term health and potential of our children. It is important to understand that this book is not the final blueprint, nor does it contain all the answers neatly packed. It is something far more valuable. It is an essential resource and a critical starting point for deeper inquiry. To our colleagues across government and civil societies, we encourage you to utilize this publication to its fullest potential. Allow its comprehensive evidence to inform your current initiatives, refine your methodologies, and spark new, more strategic conversations within and beyond your organizations. So use it to reflect on how our collective efforts can be more integrated and focused on the true drivers of chronic malnutrition in our country. We close today with clearer vision and renew our sense of purpose. Our shared mission is to patiently and persistently transform this rigorous and research into sustained, meaningful, and collective action. So together, we will keep raising the bar until every child in the Philippines has a fair and fighting chance to reach their fullest and brightest potential. The children of this nation deserve a future where their growth knows no ceiling and their dreams have no limits. It is our shared responsibility to build their future and to raise the bar enough to make it a reality. Maraming salamat po at mabuhay tayong lahat.
Thank you very much, Dr. Dino. At this point, we're near the end of the program. Once again, thank you to our distinguished presenters and discussants. Your perspectives have truly enriched today's discussions and inspired meaningful reflection as we move forward. So let's please give them one round of applause for their very insightful discussion and the participation of everyone as well. So we appreciate your attendance today. The speaker's presentation will be available at the PIDS website at www.pids.gov.ph/events. Meanwhile, download a copy of the book from the link on screen and Facebook comment section. We want to hear your thoughts about today's program. For our on-site participants, please help us improve our events by answering our feedback form. Kindly submit the accomplished form at the registration booth located outside upon getting your copy of the book. Your feedback and recommendations will make our upcoming events better. Keep in touch with us as well. Follow PIDS and UNICEF Philippines on Facebook, Twitter, X, and YouTube channels for more updates. Also, feel free to visit our websites for more information. We hope to see you again in our future events. Join the PIDS for a forum on October 21. Please visit the PIDS webpage at www.pids.gov.ph/events again to learn the details of our upcoming event and register. Now, to conclude the event, once again, calling all the attention of our participants, please proceed on stage for a final photo opportunity before we proceed with our lunch. So please proceed on stage for a quick photo op. Our author, sorry. The book chapter authors only, apologies. Again, calling the attention of the book chapter authors.